This is your local election headquarters.
Welcome back. Well, the White House is granting ICE access to the personal data of the nation's 79 million Medicaid enrollees. Officials say the information will be used to track people here illegally. The agreement does not allow ICE to download that data. Instead, agents will have 8-hour sessions Monday through Friday. The agreement ends September 9th. President Donald Trump's nomination for director of the U.S. Mint may be a familiar face to some here in the state. Former state senator and Bessie member Paul Hollis has served his constituents for over 12 years. If approved, he will join a number of other Louisiana natives in Washington. The board behind the Livingston Parish Library voted not to renew the director's contract. The Library Board of Control held an executive session to discuss the renewal of Director Michelle Parrish's contract. The parish president says it was a necessary move and a fresh face was needed to lead. The 4 board members who voted against ending Parrish's contract resigned. Could rural hospitals be in trouble? Well, Medicaid cuts prompted by the new spending bill will trim $1 trillion. One healthcare leader tells Brianna Moore about what that means for hospitals and patients.
The first thing they say, well, how many rural hospitals are going to shut down? And I say 0, and that pretty much ends the interview, to be honest with you.
A question on many minds today. What impact will the proposed health care legislation have on Louisiana? Jeff Reynolds, head of the Louisiana Rural Hospital Coalition, spoke today, offering insight from 35 years in health care. He says 1.6 million Louisianans are on Medicaid, 1.8 million have private insurance, and about 300,000 remain uninsured, a gap he believes the bill could impact.
With the large number of people in Medicaid and in the uninsured, that is a case, we've got more in those groups than we've got in private insurance. So it becomes very difficult to maintain operations, maintain the services across the state for everybody.
Reynolds says for now, no rural hospitals in Louisiana are set to close, but says changes could come. Over the next few years, Louisianans could see shifts in Medicaid and Medicare eligibility.
Starting in October 1st, 2029, the federal government is tasking the states to start collecting the address information on enrollees.
Starting in 2026, Medicaid expansion adults in Louisiana will face eligibility checks every 6 months instead of once a year. Jeff Reynolds says that change could lead to major coverage losses.
But we also know that there will be a certain percent of them that fall out of the Medicaid bucket on the previous slide down into the uninsured bucket.
Enrollees will need to work, go to school, or train 80 hours a month. Co-pays of $35 will also apply for specialist visits, but Reynolds says many patients can't afford them. Starting in 2029, Louisiana faces major health care funding cuts, with hospitals projected to lose billions by 2035. Reynolds says the state could gain $100 to $200 million through new funding for rural health.
This is all 100% federal. LDH does have to apply for this money between now and December 31st.
Reporting, Brianna Moore, Louisiana First News.
Reynolds says new funding could help rural areas by boosting disease prevention, tech solutions, and clinic staffing. Stay with us. We'll be right back with a look ahead.